For over a century, the ritual of medicine was ironclad. You sat in a beige waiting room, smelled the antiseptic, and waited for a handshake. The white coats, the exam rooms, the physical presence. It wasn't just tradition. It reinforced trust, seriousness, and the assurance that your health mattered. Then, almost overnight, that system fractured. The doctor's office moved from the clinic to your kitchen table. But as healthcare crosses this digital threshold, we have to face an uncomfortable truth. Convenience is a dangerous metric for health. A screen may be easier, but is it actually safer? Consider this. In 2020, telehealth visits in the US jumped from less than 1% to over 30% of all patient encounters. Globally, governments relaxed regulations, reimbursed virtual visits at parity with in-person care, and approved remote prescription services. What was once optional became essential, almost overnight. Yet this rapid adoption left many questions unanswered. Which patients truly benefit? Which conditions can safely be managed online? And which risks are hidden behind the convenience? Telehealth, a historic leap. Telehealth didn't just grow, it exploded. Medicine advanced by what should have taken decades. Doctors and patients adapted out of necessity, not choice. But speed and convenience don't equal better outcomes. Mistakes in medicine carry real consequences. Efficiency is meaningless if accuracy is lost. The key question isn't, is it faster? It's, is it effective? Globally, telemedicine adoption varied widely. In the US, rural areas saw the most dramatic increases, while in parts of Europe and Asia, digital platforms became essential for maintaining continuity of care during lockdowns. Yet, the digital divide meant that many low-income and elderly patients were at risk of being left behind. Case study, mental health. Meet Sarah. She's 28 and lives with persistent generalized anxiety. Crowded clinics overwhelmed her senses, causing her to miss nearly 40% of appointments. Healthcare felt intimidating, stressful, and something she avoided. Then care moved online, and everything changed. From home, Sarah felt safe, empowered, and in control. She attended every session consistently and confidently. Telehealth isn't just convenient for mental health, it's transformative. Studies published in JAMA Psychiatry show teletherapy is as effective as face-to-face therapy for anxiety and depression, and adherence can improve by 20 to 30%. Access expands particularly in rural areas, where 1 in 5 Americans live in areas with a shortage of mental health providers. Digital tools complement therapy. Mood tracking apps, medication reminders, and cognitive exercises enhance engagement. Group therapy and peer support programs can also move online, making social connection easier for patients who struggle to attend in-person sessions. For mental health, access itself becomes part of the treatment. Case study, chronic disease management. Now meet Robert, 65, managing type 2 diabetes. His specialist lives 50 miles away. Each visit once meant hours of exhausting travel. Those trips drained energy and time. The journey itself became part of the illness. Today, Robert's care looks very different. His glucose monitor sends real-time data to his doctor, letting decisions be based on trends, not memory. Adjustments happen faster and more precisely. Remote monitoring for chronic conditions has been shown to reduce hospitalizations by 30 to 40%, according to the Lancet Digital Health. Telehealth improves efficiency, empowers patients, and ensures frequent check-ins prevent major complications. Here, distance stops being a barrier to care. Telehealth also supports preventative care. Patients can receive reminders for routine lab tests, vaccinations, and screenings, all without leaving home. This proactive approach can catch potential issues before they escalate, saving both lives and healthcare costs. Limitations of telehealth. But medicine isn't just data and screens. Physical presence matters. Some conditions demand touch, subtle observation, and sensory cues. Doctors can't palpate an abdomen, feel lymph nodes, or assess muscle tone through a camera. Texture, temperature, resistance, these details guide critical decisions. Physicians also rely on instincts formed in the room. How a patient walks, breathes, or moves subtly often reveals more than words ever could. Online visits risk losing these vital clues. Studies show telehealth can increase follow-ups for urgent symptoms, sometimes leading to referrals to in-person care instead of resolution. Misuse can delay treatment, create double appointments, and even raise costs. There's also the equity problem. 15% of adults in the U.S. lack reliable broadband, disproportionately affecting rural and low-income patients. Privacy and security must also be considered. HIPAA compliance is critical, yet not all platforms meet standards. Telehealth isn't universally safe for complex conditions, acute pain, or sudden symptoms. A headache could be a migraine or something more serious. Without proper examination, subtle warning signs may be missed. Additionally, telehealth can't fully replicate the emotional reassurance of face-to-face care. For many patients, the physical presence of a clinician conveys empathy and confidence that a screen cannot. There's also the risk of miscommunication. Technical glitches, poor lighting, or background distractions can obscure crucial information. Finding the right balance? So what's the verdict? Telehealth isn't inherently good or bad. Its value depends entirely on context. The right question isn't, is it better? It's, when does it work? Telehealth excels in mental health care, chronic disease management, and follow-ups. But acute conditions, new pain, and complex diagnoses still require in-person evaluation. One model cannot fit all cases. Flexibility is essential. The evidence points to a hybrid solution, digital and physical care working together. Telehealth expands reach. Clinics provide certainty. Together, they form a stronger, more effective system. A thoughtful approach means leveraging technology where it enhances care, without letting convenience compromise safety or quality. Ultimately, the goal is not to replace the doctor's office, but to make healthcare more accessible, responsive, and patient-centered. The future of telehealth. Telehealth is a tool, not a cure-all. Every tool has a purpose. Misuse creates risk. Proper use creates impact. Looking ahead, technology will enhance virtual care. AI can triage patients, flag red flag symptoms, and help prioritize urgent cases. Connected stethoscopes, otoscopes, and AI-assisted imaging are already piloting ways to bring the exam room online. The doctor of the future will need more than bedside manner. They'll need wisdom to know when a screen is enough and when it's not. Emergency adoption must evolve into intentional design, balancing speed with strategy, convenience with accuracy. Telehealth can also promote global collaboration. Specialists can consult across countries, allowing patients in underserved regions to access expertise previously unavailable. It's not a replacement for local care, but a bridge to knowledge. If you've had a virtual visit, share your experience in the comments. Your story helps shape a healthcare system that's more equitable, effective, and responsive. If you want to stay ahead of health technology, subscribe. Clear analysis matters more than hype. We're building the future of health, one decision at a time, one tool used wisely. Thank you for watching, and I'll see you next time.